and stuff.
Yeah.
Okay.
All right, you're live.
Oh, hey guys. So we're going to start Aerolase today. I just want to make sure it doesn't shut off. So we're doing Aerolase on our patient's back, chest, and arms for hyperpigmentation. So if you take a quick peek down here, you can see that there's a little bit of PIH and darker brown pigmentation. So the PIH is that pinkish brownish color that comes after the inflammation of acne typically. And then there's just also some brown pigment that's old left over from the past, and it tends to get darker with the sun. So for a patient like this who's getting some of these breakouts, there are a couple things that you want to ask and talk about, and I want to give you a little overview on that before we actually start treatment. One of those is, are you working out a lot? Are you sweaty? Are we showering? What are things that we can do to prevent active acne? And then also, what are the things that we can do to make the pigment better? So as far as treating active acne, products are super important. The way that we shower quickly after working out, getting sweaty is going to be key, and then incorporating things like glycolic and salicylic acids. We have wash sprays and all of these, so we will begin to incorporate that. And then also, the other thing that's important for treating acne like this, so it does eliminate and doesn't recur as much, is getting regular back facials. So that's great. Our esthetician Shekinah does all kinds of facials, and the back is actually a really common area because you want to be opening up some of these clogged pores. You can see areas where there's oil trapped deep in the skin, and we can just use a little lancet and extract some of these and then infuse anti-acne and pore clarifying solution. So we do dermal infusion. Sometimes we have to just nick and remove the oil that's trapped in the skin, and we can also even do light peels on the back, just with extra caution in summer with the sun. A lot of S's. So we're going to start treatment now. On my side of things, we do lasers and peels for pigment. So I'm going to get started. It's kind of loud. So this is a micropulse YAG, and we're going to target all of these areas of pigment and acne. Aerolase is a really cool device because what it does is it releases the energy so quickly in the skin that it doesn't cause much of a pain response, and it will actually target the browns, the reds, and the active acne. So we're going to get started. I'm going to start on the top of your shoulder blade. So you can see here I'm focusing on this little lesion and just zapping it. And I'm going to spot treat the darker areas. Does it hurt?
I don't feel anything now.
Don't feel anything? That's amazing. So some of these areas, I'll treat the whole area like this, where our patient is more prone to breaking out. If you notice, it's actually in the areas where his hair tends to grow. So he has less on his upper back by his shoulder blades, less by his spine, and more so on this lateral portion where his hair is actually distributed. So right now what I'm doing is I'm picking a small section, and I'm starting to build up a little bit of heat in the skin, and we're going to float over this area once or twice, change our energy, and then target the areas of pigment. So this is a very comfortable laser. He doesn't even feel it, which is great. He might get a little bit of hair reduction, which is also great. And this laser, what makes it so unique is that it's safe for all skin types. Position myself. So this is something that can help any Fitzpatrick patient. And the reason that that's important is because this type of acne that falls within the hair is very much characteristic of like a pseudofolliculitis, and a lot of patients get that, especially with darker skin types, thicker hair, and it can happen on the face, cause big inflammatory lesions, and they're uncomfortable, and they can cause scarring, and this is a treatment that's super safe to reduce it. So it's a great thing to incorporate into your regimen.
And how many treatments do you need?
So with Aerolase, it is so gentle. It is effective, but you want to be consistent and typically go for about 4 to 8 treatments. And it depends what you're treating. The device is cool. It can even treat nail fungus, believe it or not. But it depends on how frequently you're treating and how aggressively you're treating with it. So typically averaging 6 treatments for something like this. And we combine it with other things. We're going to incorporate really good skincare, probably some back facials and peels. So that makes the improvement come along much quicker. Any other questions?
Nope, that's it.
All right, guys. So I'm going to finish up. It is a large area, but if you have any questions, let me know, and we'll get back to them. Thanks for watching.